And finally, let's talk about the amnestic disorders. These are the disorders where you basically have prominent memory impairment in the absence of disturbances in either your level of alertness or other kind of cognitive disturbances. Now, typically there are numerous risk factors why patients have amnestic disorders, whether it's damage to certain areas of the brain, whether it's thiamine deficiency, whether it's a head trauma, whether it's CVA, infections, hypoxias, any kind of seizures, any kind of surgical procedures, but of course, the most common cause of amnestic disorders is alcohol. So these are patients who probably have a history of alcoholism. And because of their alcoholism, they have nutritional deficiencies which lead to their amnestic disorders. One of the presenting symptoms of patients who have these amnestic disorders will be the memory deficits. Now, these memory deficits will either be sudden or they could be gradual. Because of the memory deficits, many of these patients will end up confabulating. So they make up stories for things that they do not remember. And this is what you classically find in patients who have Korsakoff's. So when you do a physical exam in patients who have these amnestic disorders, you will typically see evidence of alcohol abuse. So you might find an enlarged liver, you might find abnormal blood tests, anything that would be consistent with the patient's heavy use of substances. Now, when we differentiate Wernicke's from Korsakoff's, it's important to recognize that both of them are due to thiamine deficiencies. However, Wernicke tends to be acute, tends to be reversible, and it has a triad associated with it, which consists of ataxia, nystagmus, ophthalmoplegia. Korsakoff tends to be more chronic, tends to be irreversible, and you tend to find confusion, psychoses, confabulation, as well as anterograde amnesia. And if you recall, anterograde amnesia is the inability to learn new information. So if you were to go into that patient's room in the morning and present yourself as a treating physician, that patient will probably not remember who you are that afternoon. And the diagnostic tests are relatively the same. You'll probably do EEGs, or neuroimaging or neuropsychiatric tests. And many of these could be abnormal, again, depending on what the disorder is. And the treatment for both Wernicke's and Korsakoff's will be giving the patients thiamine. And the main differential diagnoses will be delirium, dementia, or substance. Let's look at a case. A 65-year-old woman is found by the police in a filthy apartment after they were called by neighbors complaining of an unpleasant odor. Police find spoiled food in the kitchen, clogged sinks and toilets, and a severe infestation of cockroaches. The woman angrily refuses to leave with the police, stating that her neighbors have threatened her with attack and she fears that they will rob her apartment in her absence. Emergency room assessment reveals a very frail and unkempt woman who is completely alert and attentive. She believes it is 10 years earlier than it actually is, and she seems confused about her current finances and social contacts. She is unable to give the current addresses or phone numbers of her children and cannot find her book or purse. Is this agoraphobia, amnestic disorder, anorexia, delirium, or dementia? This woman, of course, has dementia. You see the problems with executive functioning, you see some of the psychotic symptoms, you see the memory deficits that are so characteristic with patients who have the dementia of the Alzheimer's type. So the answer here would be letter E.